Hey, it's Dr. David Frank of Walden Dental with another episode of Tooth Talk. Where not only do we talk about dentistry, we talk about health and wellness and what is the most modern, up-to-date way to live your life the most authentic and healthy way possible. And I am honored and pleased today to have two representatives from DenseFly Serona, which is a fantastic, phenomenal dental company that allows dentistry to be leveraged to the max and to really help our patients have that second to none experience to be efficient with their time, efficient with their dentistry, and to give a product that is so precise, we often think, how could we go anywhere else? So today we have with us Andy Miller and Adam Creath, and I would love for you guys just to kind of introduce yourselves here, and then we'll go right into the topic about what dentistry is all about when it comes to DenseFly Serona. Go ahead, Andy.
So Andy Miller, local rep here in Austin, cover San Antonio, Valley, West Texas, sell Cerac. So cover anything from Prime Scan to our new Prime Mill that's out, the suction, as well as our Speed Fire oven, as well as zirconia blocks.
Gotcha. How about you?
So I cover imaging for DenseFly Serona, and imaging would be related to when you go to the dentist, it's going to be the machine that you stand in that goes around your head. It's called a panoramic. We also do something that you have as well, as it's a cone beam. It does a 3D of your face. And also those really comfortable sensors that go in your mouth where they put the deal up and they take the x-ray. We have that as well. So it's all imaging to get to know you.
Gotcha. So I guess one thing that folks are really going to want to know is why this technology and why do we need, let's just start right with imaging first, because imaging is our gateway to identify, do patients even really need treatment? Where has that technology gone from the element of how that can really help patients when they feel like, I don't even want an x-ray?
Right, so back in the day you had your standard film x-rays. The dose to the patient was really, really high. Time went on, we came up with digital x-rays that go inside the mouth. Those are the sensors that you have. We progressed and we moved into cone beams. So now dental practices are putting in 3D imaging. Because when you go to the practice, you go to an office, it's your first trip there, you need somebody who can get to know you as quickly as they possibly can. So having 3D imaging with a quick trip around your head, it's going to come up with about 700 slices of x-rays that you can study to get to know your patient quickly. Maybe they don't think there's anything wrong, but it's your job to be able to find out how can you help them. Suppose you come in and you have a cracked tooth, maybe you need an implant. Having 3D imaging is just phenomenal, the amount of information it gives you to be able to treat the patient as quickly as possible.
I mean, in going on that, as far as being able to see things in 3 dimensions, dentistry has had a lot of challenge trying to figure out some folks that have unexplained pain.
Right.
And it's not so clear cut on those traditional images. And I always use the analogy for patients trying to see a cracked tooth on an x-ray is like getting a 1 in a million shot, because your x-ray beam has to go in the exact angulation and being perfectly parallel to where that crack is. And that's really, really hard. But I know personally, since incorporating 3D imaging, the ability to check that tooth in all different directions really helps to aid in that diagnosis to identify what isn't the tooth or what isn't the problem with the tooth, and then whittle it down to really be that much more accurate. What have you experienced with other dentists that you've worked with and how you've seen the technology progress?
I mean, it's amazing. The information you see on your first 3D scan, it's phenomenal. Because like you said, on a 2D x-ray, you have to have that perfect shot. And if the problem's there, it's probably pretty substantial at that point. With the 3D and getting all these slices, we can catch things early on. And for you to be able to sit there with the patient in the chair and pull up this 3D image, you can spin around the skull, you can fly through out from their cheek towards their tongue and look through all these slices within the tooth. You are going to catch things sooner. And it's the same thing for other dentists that I work with. As long as you use that amazing technology, the patient's lives are made better because of it, and your job is made easier.
And I couldn't agree with you more as far as it's beyond the scope of just teeth too. So many of our patients are complaining about sleep-related issues, but not necessarily knowing that there is an oral component to it. Or oftentimes what dentists are checking is that they're seeing this grinding and clenching that has continued on and all of this wear patterns, and then patients reporting that they're having to take certain medications to fall asleep, or they're having challenges with staying awake during the day. Tell me about what some of the imaging is able to offer us and being able to help aid in identifying are they having a sleep or airway related issue?
What's so amazing about 3D imaging, it's not just about the teeth, so I'm glad you brought that up. You can see the airway. And for patients that who've been suffering with sleep, maybe they snore, their spouse complains about that all the time. Suppose you've tried CPAP, you've gone through a sleep test and you're trying CPAP. There's not a great compliance rate with people actually using it. Ask somebody who uses a CPAP, it's not really enjoyable. But there's other treatments available, and those aren't sleep appliances. And for people who are more moderate, taking a 3D scan can show you the airway. We can colorize that airway and show you, well, it looks like you're clenched off in this area right here. Maybe it's time that you have a sleep test, and let's determine if a sleep appliance would be good for you. So it's not just, just how do we take care of the teeth. There's so much more that you can do with the technology.
And following suit with comfort with going to the dentist, I know so many patients are constantly complaining about, I don't want things thrown in my mouth, with things that are gagging and taking impressions. Andy, tell me a little bit about like leveraging digital technology in digital impressions, what CEREC is able to do for people that not only feel claustrophobic, but people feel like, I just need to avoid the dentist because I can't stand leaving something setting in my mouth for minutes, wondering if I'm going to choke.
Oh yeah, I was one of them.
Yeah.
I don't do well with impression material, and I came over from that division before I came on the CEREC division. It's all about patient experience, and that's where CEREC plays a key role. So with our technology, we can do digital scans, send off to a lab. We have the option to do single unit crown. We can now scan fully dentulous, scan for impressions, do custom abutments. There's a whole host of things that we can do with CEREC. But the biggest thing that I've taken away as a sales rep is a single patient visit. They're not coming in for a second visit. The patient that may be really scared of going to a dentist, my mother for one. She found a doctor, she did research at the age of 70, was doing research on CAD/CAM before I even came to this division.
Gotcha.
I was competing against it with my impression material, and she looked it up and she saw it and she's like, what do you think about it? I go, well, it's great. You get your crown that day, you may sit around for an hour and a half, maybe 2 hours at the most to get that crown.
Right. I mean, in the dental community, we all see this as almost kind of common knowledge that digital dentistry, single visit dentistry has been around, but for many folks, they're blown away at this concept. And we were able to really introduce that to Austin last summer when we had an episode on K-View talking about this type of dentistry and single visit dentistry. The amount of feedback that we got from new patients was, I cannot believe this is done. Tell me about some of the other experience that you've had with other dentists that have started incorporating it and how they have basically given the feedback of what their patients are expressing.
Sure. So to kind of go back to what you were saying, this technology, it's actually been out for 34 years. So it's really evolved over the last couple of years. So we had OmniCam, now we have PrimeScan, which is the fastest and most accurate scanner on the market. It's actually as equal, according to a new study, to show the same as a goop impression material would be, which is big. But as far as patients go, I was one of those patients that had to get 3 temporary crowns. And I literally had to wait maybe, 3 weeks for that crown to come in. I had messed up my margins, so I had to wait another 3 weeks to a month. But one thing when I talk to doctors that are just now getting into it, I call them usually, so it comes with full day training in office, and then they're able to go out to Arizona or North Carolina through CDOCs and be able to go do hands-on training, which is a 2-day event. I usually call the week after, and they're like, this thing's so easy. I'm surprised that I haven't had this for the last 10 years. What they're noticing is production uptick. They're noticing that patients are a lot happier. patients are actually referring more because of this product that they just brought into their office.
I mean, and I can attest to that, having started with the technology back in 2007, even with the red cam, and having to have the precision and accuracy and the challenge of really having to understand the nuances of that technology, where it has come literally 13 years later. I mean, it is remarkable on how user-friendly and how precise and accurate it is, to the point for me personally, I don't know if I could go back to be doing impression lab, and having gone through the COVID-19 crisis and the concern and worry about infection control, it was an amazing ability to leverage technology to make people feel safer, that we don't have to send things out, and that we do have such a wide variety of material selection. Where can folks that have been watching this today be able to find out more about these products? Where, not only from a patient perspective, but a provider perspective, to say, hey, this is something that I think I really need to pursue. Where can they find more information about that?
DenseFlySerona.com.
There you go.
CDocs for doctors.
Yep. Which has been remarkable for me, by the way, where I have been able to really increase my knowledge and expertise by attending their courses, all the dozens of class workshops that I have attended, and now being a mentor in that has helped given such a huge peace of mind. Knowing that not only is there a great community, but you're learning the most cutting edge way and seeing how predictable it can be. Again, thank you for watching another episode of Tooth Talk, where we got into the deeper layers of advanced technology. Stay tuned for other episodes as we go beyond the scope of just dentistry and into other forms of the overall health and wellness to let you live your most authentic self. Take care, live well, and smile.